When it comes to colorectal cancer, screenings save lives. Today, we are learning more about who should be screened and when with Dr. Jeremy Wigginton. He's the medical director for Blue Cross and Blue Shield of Louisiana. Welcome back, Dr. Jeremy.
I appreciate it. I'm glad to be here to talk about an important topic.
Yeah, thanks so much for being here. And if people don't know, March is actually Colorectal Cancer Awareness Month, and this type of cancer is actually one of the most common among men and women. What else should we know about this type of cancer?
Sure. Well, first of all, like you said, screening is really important, and screening will save lives, but you got to get screened. You actually got to do it. So colorectal cancer, it usually forms in the colon, which is the last several inches of the large intestine that opens to the outside world. And so little polyps or growths can occur in the colon that can then turn into cancer. So it is one of the leading causes of preventable death. So it's one of the leading causes of cancer-related death and also preventable cancer-related deaths. So it's very important to know about colon cancer, when it can occur, how you should get screened, and the impact on your life that screening can have. So it's something you really want to know more about.
It's so true. And let's actually talk about colonoscopy screenings. When should people start getting them?
So it used to be that the person of average risk, so men and women of average risk, would start at age 50 getting a colonoscopy. But recently, about 6 months ago, the recommendation changed to lower that age to 45 years of years old. So the United States Preventative Service Task Force changed that recommendation. The American Cancer Society has changed that recommendation to lower it. If you're average risk for colon cancer, you should start getting your colonoscopy colon cancer screening done at 45. If you have other conditions like ulcerative colitis or Crohn's disease, you may be eligible to get screened earlier, or if you have specific conditions in your family history, like a really early history of colon cancer. So definitely talk to your provider about that risk level. But right now, it's been lowered to 45 for average risk people.
And why did they do that? Is it because they're trying to detect it earlier?
That's right. So people were getting screened due to other illnesses and because of family history. Some people were just getting it done before 50. There's been a lot of health studies. There's been a lot of research done on the age. And so what we found is that there is a population between that 45 and 50 that can start to have signs of early colon cancer. So after we got a lot more research done, we decided that it was health officials decided that we should lower it down to 45. That would be the best for everybody.
And this is for men and women, but say people who are younger want to try to prevent getting colon cancer and they're not eligible for a screening yet. What can they do to prevent this from happening, if it is preventable at all?
Sure. Well, start as early as possible. And really the take home is to be as healthy as possible. Don't smoke, drink in moderation, trying to eat a healthy diet. And the key there is high in fiber. So lots of fruits and vegetables. Exercising regularly, lots of cardiovascular type exercise, at least 30 minutes of cardiovascular exercise, walking, jogging, high intensity kind of sports, that sort of thing, at least 30 minutes, 5 times a week. And maintaining a healthy weight. So keeping your BMI, your body mass index, within a normal range would be a great place to start. So thinking about just staying healthy in general will not only help to prevent colon cancer and reduce the risk of colon cancer, but the risk of a lot of diseases and a lot of other cancers.
It's so true. And of course, people are wondering, since we have, a health expert here who represents Blue Cross and Blue Shield of Louisiana, is this covered in a health plan?
This is a preventative screening that we are recommending, and like I said, national health officials have recommended. So all health plans should be covering these screening tests at little to no out-of-pocket costs. So, but definitely if you have a question, you want to know exactly what the coverage is, check that number on the back of your identification card for your insurance carrier. But like I said, it should be little to no out-of-pocket costs for these really critical preventative health screenings.
So important to know. And how effective are these colonoscopy screenings?
But colonoscopy is the gold standard. So it is the best way to check for early signs of colon cancer. So they use a small camera about the size of my pinky finger to go inside the colon, to look around for signs of cancer, to find anything that looks like early cancer. Not only can they identify it, but they can remove it at the same time. And that is exactly why it's so effective. So not only can we see if there's already cancer, but if there's anything early, that can actually be identified and removed. So that is why it is so effective at preventing cancer-related or colon cancer-related deaths. So again, that those long-term complications from having advanced cancer or even dying from colon cancer can be prevented if you get the colonoscopy done really, really early. So talk to your doctor about your risk for colon cancer and when you should start screening. And if you're 45 or about to turn 45, go ahead and plan to get it done.
I like that you said if you're about to turn 45, because some people maybe in their early 40s are like, I still got 3 years. No, think about this now, because again, we don't want people to get colon cancer. Thank you so much, my good sir, for joining us this morning. As always, and hey, to learn more about colorectal cancer is the name of the condition, and colonoscopy screenings in general, log on to bcbsla.com. You can also find other great health information on their social media at BCBSLA. All right, stick with us, everyone. A lot more to come on Great Day, Louisiana, when we come back.